All right, so continuing on from our last lecture, going to start with a little bit of fact or fiction. So fact or fiction, put ointment or butter on a burn to soothe the pain. That is fiction. So placing greasy substances such as an ointment or a butter on a burn is not going to be effective for relieving pain or promoting healing. Greasy substances can seal in the heat and make the burn worse. A sunburn is a type of thermal burn, fact or fiction. So sunburns are caused by overexposure to the sun's ultraviolet or UV rays, and is actually a type of radiation burn, not a thermal burn. It is a radiation burn. Fact or fiction, when a person has experienced an electrical burn, you need to be prepared to give CPR and use an AED. So electrical burn. That is a fact. So the electrical current that caused the burn can also cause a cardiac or respiratory emergency. Fact or fiction, apply ice to a burn to cool it. That is fiction. We never want to use ice to cool a burn, as this can cause more damage to the skin. It is important to monitor for shock when a person has been burned. That is fact. So, among other things, burns of all types can cause a person to go into shock, so we need to look for those signs and symptoms. When a person has been burned by a chemical in powdered form, you should remove the chemical by flushing the area with cool running water. That is fiction. So, in powdered form, the first thing we need to do is put on gloves and remove or brush away as much of it as possible. Then we want to flush the area with cool running water for 15 minutes or until EMS arrive. When a person has experienced an electrical burn, you should not go near the person until the electricity has been turned off at the source. Again, that is a fact. We never want to go near the person until we are positive that the electricity has been turned off at its source. To cool a thermal burn, we want to use cool or cold potable water. That is a fact. So thermal burn can be cooled using cool or cold potable or drinkable water. Okay, so we want to make sure that that water that we're using, if at all possible, is drinkable, meaning that it won't have the bacteria and other things in there that could infect that burn. All right, so moving on, and we'll be brief in this kind of section, as it is more or less kind of what our entire class has been. So muscle, bone, and joint injuries, signs and symptoms here that are pretty common across the board: pain, swelling, bruising, and an inability or unwillingness to move the injured body part. The injured body part may be bent, crooked, or otherwise deformed. They may hear or feel a pop or a snap at the time of the injury. They may also get a quote-unquote grating feeling or sound when moving the injured body part. So we need to call 911 or the designated emergency number if a broken bone is protruding through the skin, meaning an open or a compound fracture. If the injured body part is bent, crooked, or looks deformed. If there is moderate or severe swelling and bruising, or if they heard or felt the injured area pop or snap at the time of the injury. Also may need to call 911 if they hear a grating sound when attempting to move the injured body part, if they cannot move or use the injured body part, if the injured area is cold and numb, if the injury involves the head, neck, or spine, or if the person is having trouble breathing. May also need to call 911 if they are showing signs or symptoms of shock. If the cause of the injury makes you think that the injury may be severe, or that person may have multiple injuries, such as like a car crash, something like that, or if it is not possible to safely or comfortably move the person to a vehicle for transport to medical care. So general first aid care is going to be the same for all types of muscle, bone, and joint injuries. If you've called 911 and are waiting, for EMS personnel to arrive, we want to have the person rest without moving or straightening the injured body part. If the person can tolerate it, you can apply ice or a cold pack, and you may not want to attempt to splint the injured body part unless you are trained to do so. So if calling EMS is going to be unnecessary, similar to some of our more minor injuries, we use the REST or RICE acronym. So rest, immobilize, cold, and elevate. Not going to spend much time on that. We've been over that ad nauseum. Moving on to head, neck, and spinal injuries. So signs and symptoms here may be the mechanism of injury, such as a fall from a height, traumatic injury involving machinery or a vehicle, a blow to the head, or entering a shallow body of water head first. Another sign may be a broken safety helmet or a loss of consciousness, however brief that may be. So signs and symptoms of these injuries, they may have behavior similar to that of a person under the influence of alcohol or drugs. So confusion, stumbling, repeatedly asking the same questions, memory loss, nausea or vomiting, or speech problems. They may have head, neck, or back pain, may have a partial or complete loss of sensation or movement in the part of the body, may have bumps, bruises, or a depressed area on the head, neck, or spine, could have blood-tinged or clear fluids leaking from the ear or nose. Clear fluids leaking from the ear or nose, that's a big red flag to get them to the ER, as that could be potentially cerebrospinal fluid, which is no bueno. May have bruising around the eyes or behind the ears, another big red flag. May have impaired breathing, blurred vision or sensitivity to light, or seizures. So if you think a person has a head, neck, or spine injury, we call 911. We approach the person from the front so that they can see you without turning his or her head. And we want to tell the person to respond verbally to our questions rather than nodding or shaking his or her head. We want to have the person remain in the position in which he or she was found until EMS arrive. If they're wearing a helmet, we don't want to remove it unless we have specifically been trained on how to, and it is necessary to remove that helmet to give CPR.
A concussion is a traumatic brain injury that alters the way the brain functions. Concussions can occur anytime a person experiences a bump, blow, or jolt to the head or body that results in rapid movement of the head. Many people who experience concussions do not lose consciousness, or they lose consciousness only briefly. A person who has experienced a concussion may have physical signs and symptoms, such as headache, blurred or double vision, sensitivity to light and noise, problems with balance, and nausea or vomiting. A concussion can also affect the person's ability to think and remember. For example, the person may have trouble following instructions or be unable to recall events that occurred immediately prior to or following the injury. You may notice changes in the person's mood, such as irritability, sadness, or anxiety. The person's behavior may also change. For example, the person may sleep more or less than usual. The effects of the concussion can last for several days, weeks, or longer, depending on the severity of the injury. If you think a person has a concussion, advise the person to stop the activity he or she was engaged in when the incident occurred. The person should follow up with a healthcare provider for a full evaluation if EMS has not been called. Giving the brain time to heal is essential for recovery, and the person's healthcare provider can best determine when it is safe for the person to return to normal activities.
So signs and symptoms of a concussion can be grouped into 4 categories. We have thinking and remembering, physical, emotional, and behavioral. I'll let you kind of read those. Again, we've been over concussions, a bit of a review here. So if a person has sustained an injury that could cause a concussion, even if they are not showing signs or symptoms of a concussion, the person should be seen by a healthcare provider. All right, so putting it all together, you want to kind of think about this all together. So you hear a coworker shout in pain, you stop what you were doing and go investigate, and we find this. So you can see he's bleeding. So what should you do? Go ahead and kind of think about that. So again, we want to glove up, protect ourselves. We want to apply direct pressure with gauze and a compression bandage. If the gauze does not work, depending on how deep the cut is, you may need to use a tourniquet and call 911. For this particular cut, it looks like it could probably be managed with just direct pressure. So in a child scenario, you're playing outside, a child comes in and tells you that one of his friends is cut and bleeding. Go ahead and kind of think about that. Again, dealing with the cut and the bleeding, everything's going to be pretty much similar to the adult scenario. However, because it is a child, you do kind of want to reassure them a little bit more and talk them through the scenario, continue talking to them to make sure that they kind of stay relaxed. All right, so one of our last little sections here is going to be environmental emergencies, such as heat-related illness.
Heat-related illnesses are caused by overexposure to heat and the loss of fluids and electrolytes. In order from least to most severe, the heat-related illnesses are heat cramps, heat exhaustion, and heat stroke. Heat cramps, which usually affect the muscles of the legs and abdomen, are caused by the loss of fluid and electrolytes due to sweating. Heat cramps are often the first sign that the body is having trouble with the heat. If not addressed, heat cramps can turn into heat exhaustion or heat stroke. To give care for heat cramps, help the person move to a cool place and sip a drink containing electrolytes and carbohydrates. A commercial sports drink is best, but if that is not available, you can give coconut water or milk, or if these are not available, water. Lightly stretch and massage the muscle. When the cramps stop, the person usually can resume activity. Encourage the person to drink fluids and stay hydrated, and watch the person carefully for additional signs or symptoms of heat-related illness. Heat exhaustion occurs when fluids lost through sweating are not replaced. The person's skin will be cool and moist, and either pale, ashen, or flushed. The person may complain of a headache, nausea, dizziness, and weakness. To give care, move the person to a cooler environment with circulating air. Loosen or remove as much of the person's clothing as possible. Cool the person's body by applying cool, wet cloths or spraying the person with cool water. Fanning the person may also help. If the person is responsive and able to swallow, give the person a cool drink. Remember, the fluids to offer in order of effectiveness are a commercial sports drink, coconut water or milk, or water. Encourage the person to take small sips rather than gulping the drink down quickly. If the person's condition does not improve or the person is unable to take fluids, has a change in level of responsiveness, or vomits, call 911 or the designated emergency number. The person should not resume activity for several hours after all signs and symptoms have been resolved and the person is adequately rehydrated. Heat stroke is life-threatening. The person will have mental status changes, such as confusion or loss of consciousness, and may have trouble seeing. The person may vomit or have a seizure. The person's skin will be hot to the touch. It may be wet or dry and appear red or pale. The person's breathing may be rapid and shallow, and the heartbeat may be rapid and weak. Call 911 or the designated emergency number immediately and take steps to rapidly cool the body. Immerse the person up to his or her neck in cold water if you can do this safely. Alternatively, place ice water-soaked towels over the person's entire body, rotating the towels frequently. If bags of ice are available, place these on the person's body over the towels. Apply rapid cooling methods for 20 minutes or until the person's condition improves or EMS personnel arrive.
All right, so a little fact or fiction over heat-related illness. In order from least to most severe, the heat-related illnesses are heat exhaustion, heat cramps, and heat stroke. Is that fact or fiction? Going to be fiction. So Least to most severe, heat cramps, heat exhaustion, and then finally heat stroke is the most severe. Fact or fiction, the best prevention strategy for heat-related illnesses is to stay properly hydrated. That is a fact. So staying hydrated, very important. Water is going to be the best choice of fluid for staying hydrated. Drink a few ounces every 15 to 20 minutes, or however much you need to not feel thirsty. Heat-related illnesses only affect people who are outdoors. That is fiction. So it is a risk factor for heat-related illness, but it can also affect people who live or work in buildings that are inadequately cooled or ventilated. So those who perform indoor jobs in hot, humid environments, such as kitchen or laundry workers or factory workers, can also suffer from heat-related illness. Fact or fiction, heat stroke is life-threatening. That is a fact. So they need to be cooled immediately and need medical attention because heat stroke can be fatal. If recognized early, heat cramps and heat exhaustion can usually be corrected with first aid measures. That is a fact. When it's recognized in its early stages, it can usually be reversed. If a person is experiencing signs and symptoms of heat-related illness, it is responsive and is able to swallow, you should offer the person small amounts of cool drink containing carbs and electrolytes or water if one of these options is not available. That is a fact. So something containing carbs and electrolytes is preferred for rehydrating when a person is experiencing signs and symptoms. Cool water can be used instead if a drink is not available. Only give the person fluids if they're responsive and able to swallow, and encourage them to take small sips instead of gulping. Moving on to cold-related emergencies, not something that we face often in Texas, but important to note anyways. So signs and symptoms of hypothermia. A person may seem indifferent, disoriented, or confused. They may have a glassy stare. They may become unresponsive. Initially, the person may shiver, but as their core body temperature continues to decrease, the shivering may stop. This is a sign that the person's condition is worsening, and he or she needs immediate medical care. So you may come across a person who you believe may have hypothermia. What should you do? First, we want to get the person someplace where they can take a hot bath or shower. Give the person a shot of brandy or a cup of coffee, or move the person. So this is a suggestion. Which one should we do? Third option is move the person to a warmer environment. Make sure the person is wearing dry clothing and wrap them in a blanket. So of those three, which should you do? Going to be the third one there. So you want to move them to a warmer environment. Make sure they have dry clothing and wrap him in or her in a blanket. So you don't want to give the person a shot of brandy or take a hot bath or shower. So if you suspect a person has hypothermia, you should call 911, move them to a warmer place, remove wet clothing, and help them warm up gradually and wrapping them in a blanket. So frostbite is an injury that's caused by freezing of the skin and underlying tissues as a result of prolonged exposure to freezing or sub-freezing temperatures. Our nose, ears, fingers, and toes are going to be most commonly affected. Frostbitten area is going to be numb, and the skin is going to be cold to the touch and appear waxy. That skin may be white, yellow, blue, or red. In severe cases, there may be blisters, and the skin may turn black. So fact or fiction for frostbite. Frostbite can be treated by rubbing snow over the affected area. That is fiction. So treatment of frostbite is going to start with gradual rewarming. Rubbing snow or anything else on the area is only going to cause additional pain and tissue damage. Gently massage the frostbitten area to restore circulation and warm it up. Again, we want to handle that frostbitten area gently. Any extra or additional massaging or rubbing can cause additional pain and tissue damage. We want to immerse the frostbitten area in hot water, apply a heating bed, or hold it close to a fire to rewarm the tissues. That is fiction. So rewarming the frostbitten area with direct heat can cause additional damage, including burns. So we want to rewarm them slowly and gradually. So if frostbite is severe or the person shows signs of hypothermia, we want to call 911. We don't want to break any blisters. We want to monitor the person's condition, and if they develop signs or symptoms of shock, give accordingly care. If rewarming is attempted, skin-to-skin contact may be sufficient to rewarm the frostbitten part of the body if it is mild. Alternatively, we can rewarm the frostbitten area by soaking it in warm water, less than 100 degrees Fahrenheit to 105 degrees Fahrenheit, or until normal color and warmth returns, so typically about 20 to 30 minutes. After rewarming, we want to loosely bandage the area with a dry, sterile bandage. We can place cotton or gauze between frostbitten fingers or toes before bandaging as well. Moving on to poisoning. So we've talked about this a little bit. Signs and symptoms may vary depending on the type and amount of poison taken into the body, but could be trouble breathing, changed levels of consciousness, abnormal skin color or sweating, or abdominal pain, nausea, vomiting, or diarrhea. So with poisoning, we want to check the scene, and it will often yield clues as to the cause of the person's illness. So we want to look for open or spilled containers, unusual odors, burns around the person's mouth, or a strange odor on the person's breath, and the presence of other people who may be ill. So to give first aid care for poisoning, first we want to size up the scene and form an initial impression. We want to remove the person from the source of the poison if we can do so without endangering ourselves. Take note of any clues that might indicate what poisoned the person. Try to find out the type of poison, the amount taken, when it was taken, and how much the person weighs. So if they are showing signs or symptoms of a life-threatening condition, such as unresponsiveness or trouble breathing, or if multiple people are affected, we want to call 911. If they are responsive and alert, we want to call the National Poison Help Hotline at 1-800-222-1222 and follow the advice that they give. In closing, many resources are available to help you respond to an emergency. You can download a Red Cross First Aid app. It is free and available for iPhone and Android devices. They also have a first aid app for animals, which is kind of cool. I wouldn't worry about the other two too much. That app would be helpful, though. This doesn't really necessarily matter to you unless you are planning on actually taking the practical exam, which if you are, we're kind of running low on time. So if you want to sit and pay to get your CPR certification, please make sure to email me so we can set up a time. All right, thank you guys.